There's a tremendous synergy between research and teaching here. The research that we do is, of course, directly a collaboration with the students. Most students will say it's the field trips, the hands-on things that really fixes the lessons that they learn in the classroom into a real application. The university is very privileged to have a number of facilities, including Friday Harbor, the Pack Forest, and several research stations in western Alaska. Before Alaska became a state, the commercial fishing industry came to the University of Washington and asked to establish a research institute to study fundamental problems of the management and conservation of Pacific salmon. In order to have economies and local communities that are built around commercial or recreational fisheries, you have to have healthy fish population.
My research is on the criminal justice system, what types of outcomes happen for individuals, and what types of different outcomes happen if you're Black, or if you're Latino, if you're white, if you're wealthy, or if you're poor. We definitely need to outline the problem for people and tell the stories of people who are disempowered, but then we need to take it on a further step. That's what keeps me teaching, and that's what keeps me doing research. I love my job. I am in the exact place I'm supposed to be, and I just try and hope that I can do that for other students, and that they're able to find their passion like I did. There's a lot of people on campus, from sociology to poli-sci to Seattle Cancer Care to UW Med, that have passion for making a difference in people's lives.
My group focuses on global health technology, so looking at how do you use low-cost technology like mobile phones, cell phones, and adapt them to basically solve these global problems like health. We're taking commodity mobile phones and turning them into devices that can diagnose disease. Jaundice is one. Typically you have to do a blood draw. We recently released an app called Hema app, which can tell you how much hemoglobin is in your blood. We can do it with the phone's camera. We have another app that uses the microphone that's in the phone to basically detect the amount of airflow and air volume in your lungs for chronic asthma, cystic fibrosis. Not an easy problem, but the students have been passionate about solving these problems and really pushing the boundaries of what they can do. The creativity that's come out to create these technologies is what I'm most proud of.
What is it that makes a productive community? That's what population health is all about. We have one of the most outstanding medical schools in the country and really strong health sciences throughout. But population health is more than the absence of diseases. It really is about looking at health in terms of all the different factors that affect it. Not just your biology, but for example, socioeconomic circumstances or the environment. We're a very comprehensive university, and when you look at population health broadly, every single discipline has something to offer. So how do we put all these resources together to focus on the health of populations, including the health of our most vulnerable populations? This is about changing the world and the belief that we, right here, right now, can do it.